Hi, in this video we're going to be doing some special tests for lateral epicondylalgia, which is going to include Cozen's, Mills, and Maudsley's. So hi Kevin, how are you doing today?
I'm doing okay, and yourself?
Doing pretty good. So we're going to do some special tests that are going to assess for lateral epicondylalgia, which is associated with some pain just on the outside of the elbow here, which is consistent with what you were coming in for.
Okay.
So the first one that I'm going to do here on you, I'm going to have you bring that arm all the way to extension here. I'm going to just be placing my thumb on that spot that you were having some pain with. I'm going to have you make a fist with your hand, and then I'm going to bring you into some wrist extension, and then I'm going to try to pull you out of it, try to bend your wrist. I want you to try to keep it right here, okay?
Okay.
So with this, you might feel some pain right here where my thumb is. Let me know if you do, because if we do, then that's going to be a positive test for the lateral epicondylalgia.
Okay.
Ready?
Yep.
Okay. 1, 2, 3, 4, 5, 6. Good, you can relax. So the next one I'm going to do is going to put some stretch on those ligaments, or tendons that are attached to the extensor muscles, so the ones that were responsible for what we were just doing there.
Okay.
So I'm going to have you turn to the side for me. Good. Keeping your elbow bent. I'm going to have you make a fist this time with your thumb in your hand. And I'm going to fully flex that guy, starting bent here. And then I'm going to slowly extend your elbow, putting just gradually more stress on that lateral epicondylalgia, or
Okay.
lateral epicondyle, okay?
Okay.
Okay, ready? And then you let me know if you feel any symptoms here. Anything there?
No, just like a little stretching kind of in here.
Okay, but no pain?
No.
Okay, good. That's a negative then. So our last one here we're going to do is called our Maudsley's test. This one we're just going to be testing one of your extensor muscles instead of the whole group of them that attach there.
Okay.
So this time I'm going to have you rest your hand on the table. Good. And then so your arm's going to be about 90 degrees here. Good. And then just bringing that middle finger up for me. And then I'm going to add that resistance like I was when we were doing your wrist extension.
Okay.
And you're going to try to keep it here, okay?
Okay.
1, 2, 3, 4, 5, 6. Good. And you can relax. How'd that feel?
Good.
Good. So Kevin would be negative for lateral epicondylalgia because he tested negative for all those tests. So in this next video, I'm going to be doing radial nerve sliders for someone who has supinator syndrome. So Kevin, how are you feeling after all that we've been through already?
All right.
Okay. So this next treatment option that I'll be doing for you is going to be helping with those nerve pain symptoms you're feeling right around your elbow. We're doing this because during the assessment, I put you into some of those weird positions that put some tension on your nerves, and it came back that your radial nerve specifically kind of elicited some of those symptoms, and it got better when you move your neck, so I'm really thinking it's that radial nerve, and this intervention is going to help that radial nerve move through that pathway a little bit easier, kind of like flossing your teeth. So I'm going to be adjusting the tension at one end and releasing it at the other, so it's going to keep that nice tension just going nice and smooth back and forth. How's that sound?
Sounds okay to me.
Okay. So what you should experience with this is no sort of pain. I'm going to put you into that initial position, so you might feel a little bit with that, and then I'll back off just so you don't feel anything, but let me know if you feel those nerve symptoms again.
Okay.
So ready to go?
Yeah, let's do it.
Okay. So just stay nice and relaxed here for me. I'm going to extend your elbow, put you into that internal rotation. Nice little fist here. Any of those symptoms yet?
Nope.
Okay, good. So I'm going to be bringing your shoulder out while simultaneously moving your wrist, and I just need you to stay relaxed for me.
All right.
So bringing it out. There we go. Extending the wrist, flexing the wrist and adducting, abducting the shoulder, extending the wrist. So with this intervention, I would keep this particular patient's elbow straight in extension, just because that's where he was feeling his symptoms. And we would do this for 10 to 30 reps for about 1 to 3 sets, depending on how he handles the movements. Good job, Kevin.